Here's a number that shouldn't exist: 26,000. That's how many Americans die each year because they can't afford healthcare, not in some war-torn nation, not in a country lacking resources. In the United States of America, the wealthiest civilization in human history. Have you noticed how we've normalized the unthinkable? A diabetic named Alex Smith turned 26, aged off his mother's insurance, and discovered his insulin would cost him $1,300 a month, more than his rent. So he rationed it. He died alone in his apartment 27 days later from diabetic ketoacidosis. His body literally poisoned itself because he couldn't afford a drug discovered in 1921. This is the paradox that should keep you awake at night. We perform medical miracles, gene therapies, artificial hearts, surgeries on fetuses still in the womb, while people die from conditions we've known how to treat for a century. We have more MRI machines per capita than almost anywhere on Earth, yet we rank last among wealthy nations for healthcare outcomes. We spend twice what other countries spend, and somehow, impossibly, get less. Think about what that means. Really think about it. We've created artificial scarcity in the midst of abundance. We've taken the most fundamental human need after food and water, the need to not die from preventable causes, and we've locked it behind a paywall. The question isn't whether this is happening. The numbers are clear. The graves are real. The question is, how did we arrive at a place where survival itself became a luxury good? Where the difference between life and death isn't medical knowledge or technology, but market position. Where staying alive is, quite literally, something you have to afford. And here's what should terrify you. The system isn't broken. It's working exactly as designed. Michel Foucault saw it coming. In the 1970s, while teaching at the Collège de France, the philosopher introduced a concept that would haunt our present moment: biopolitics. The modern state, he argued, doesn't just rule through laws or violence, it rules through life itself, through deciding who gets to live, who gets to die, and under what conditions. Healthcare, Foucault understood, would become the ultimate expression of this power. But here's what even Foucault didn't fully anticipate. What happens when biopolitics meets the market? When the state doesn't directly decide who lives or dies, but instead creates a system where money makes that decision. We've privatized biopolitics. We've outsourced the power over life and death to insurance companies, pharmaceutical corporations, and hospital networks. Consider this against Aristotle's vision of society. 2,300 years ago, he argued that the entire purpose of political community was to enable human flourishing, what he called eudaimonia. Not just survival, but the ability to live a good life. The polis, the city-state, existed to ensure that citizens could achieve their potential. Healthcare, in Aristotelian terms, isn't a consumer good. It's a fundamental requirement for participating in society. Have you ever wondered why this feels so wrong on such a visceral, gut-wrenching level? Why stories of people rationing insulin or choosing between chemotherapy and bankruptcy trigger something primal in us? It's because we're violating something ancient, something pre-political, the basic human understanding that we take care of each other, that the strong protect the vulnerable, that a society's virtue is measured by how it treats its sick. But we've inverted this sacred contract. We've created what Foucault would recognize as a new form of biopower, one that doesn't need guards or gates. It sorts populations through price mechanisms. It exercises sovereignty through spreadsheets. The question, who shall live, gets answered not by doctors or ethics committees, but by actuarial tables and credit scores. Stop reading for a second. Feel that discomfort. That's your humanity recognizing what we've become. This isn't just about policy. It's about what kind of beings we're becoming. When survival enters the marketplace, everything changes. Our relationships, our sense of responsibility, our very understanding of what we owe each other as human beings sharing finite time on this planet. The philosophers warned us. We didn't listen. But to understand how deep this goes, we need to see how we got here. And the truth? It was never supposed to be this way. It wasn't always like this. Before World War II, American healthcare looked nothing like today's labyrinth of suffering. Doctors made house calls. Communities had mutual aid societies. Immigrant groups, churches, unions. that pooled resources to care for sick members. Hospitals were mostly charitable institutions, run by religious organizations or local governments. No one got rich from healing. That wasn't the point. Then came an accident of history that would reshape everything. During World War II, wage freezes prevented companies from attracting workers with higher salaries. So, they offered something else: health insurance. The IRS decided not to tax these benefits. Suddenly, by historical accident, America had tied healthcare to employment. No other developed nation made this choice. We stumbled into it. At first, it seemed to work. The 1950s and 60s saw expanding coverage, new hospitals, medical breakthroughs. But something sinister was happening beneath the surface. In 1970, for-profit hospitals made up less than 2% of American hospital beds. Today, nearly 25%. What changed? We did. Or rather, our story about what healthcare has changed. The turning point came in 1973. That year, Nixon signed the HMO Act, explicitly encouraging profit-making in healthcare. The language mattered. We stopped talking about patients and started talking about consumers. We stopped talking about care and started talking about products. A subtle shift in words that would cost thousands of lives. Have you ever noticed how we don't even question the vocabulary anymore? We say healthcare industry as naturally as we say automobile industry. But think about that phrase: healthcare, industry, the healing of human bodies as industrial process, the relief of suffering as business model. By the 1980s, the transformation was complete. Hospital corporations traded on Wall Street. Insurance companies answered to shareholders, not patients. The ethics of medicine, first, do no harm, collided with the ethics of capitalism, first, make a profit. Guess which one won? Here's what we lost in that transformation: the understanding that some things shouldn't be commodities, that markets are tools, not gods, that efficiency isn't the highest value when dealing with human suffering. Other countries faced the same post-war challenges. They built universal systems. They decided healthcare was a right, not a product. We went the other direction, not through democratic deliberation, not through careful planning, through drift, accident, and the slow normalization of the unacceptable. The question isn't whether markets can deliver healthcare. Of course they can, for those who can pay. The question is whether we're comfortable with what that means for those who can't. We've been comfortable for 50 years, and now we've built psychological mechanisms so powerful, so insidious, that we actually defend the system that's killing us. Let's dissect how a society convinces itself that letting people die for lack of money makes sense. Start with commodification. It's a simple psychological trick, really. Take something that exists outside market logic, like staying alive, and slowly, methodically, transform it into a product. Once something becomes a product, different rules apply. Products have prices. Products reward efficiency. Products don't care if you can afford them. Watch how this works with insulin. A vial costs about $6 to produce. It sells for $300. That's not a markup. That's a moral transformation. We've turned a biological necessity into a luxury good. And here's the insidious part. Once we accept that framework, the price almost doesn't matter. We've already agreed to the fundamental premise that staying alive is something you purchase. But why don't people revolt? Enter system justification theory. Psychologists have documented something that should chill you to your core. The people most harmed by a system often become its defenders. Have you ever heard someone without insurance argue against universal healthcare? Someone bankrupted by medical bills insists the system works. That's system justification in action. We tell ourselves stories to make injustice bearable. Those who work hard can afford care. Free healthcare would be lower quality. I don't want to pay for someone else's bad choices. These aren't arguments. They're psychological defenses against confronting the horror of our situation. The mechanism goes deeper. We've created what researchers call inequality amplification, where initial disadvantages compound exponentially. Can't afford preventive care? You'll need more expensive emergency treatment. Miss work for that emergency? Lost wages mean less money for medication. Skip medication, more emergencies. It's a vortex that transforms poverty into death. Consider this nightmare scenario that's someone's reality right now. A wealthy person with diabetes gets continuous glucose monitors, insulin pumps, regular endocrinologist visits. A poor person with diabetes gets emergency room visits when they're already in crisis. Same disease, different worlds. Life expectancy gap? About 15 years. 15 years of life, gone, because of a bank balance. Then there's the moral hazard narrative, perhaps the cruelest mechanism of all. We've convinced ourselves that helping people access healthcare creates moral hazard, that they'll make bad choices if they don't face consequences. Think about that logic. Really think about it. We're saying people need the threat of death to motivate healthy behavior. We've weaponized illness itself as a form of social control. Foucault called this biopower, but we've refined it into something more terrifying. The old biopower needed institutions, guards, visible force. Our version is invisible. It works through credit scores and coverage denials, through networks and formularies, through $1,000 ambulance rides that make people call Uber instead. Have you noticed how we talk about covered lives? That's insurance industry terminology, not people, not patients. Covered lives. As if life itself only counts when it's covered. As if being uncovered means being uncounted. Unlife. The final mechanism? Normalization through complexity. We've made the system so Byzantine, so impossibly complex, that people can't even articulate what's wrong. They just know they're drowning. Deductibles, co-pays, out-of-network, prior authorization, formulary tiers. We've created a language designed to exhaust resistance. Every mechanism reinforces the others. Commodification enables inequality amplification. System justification prevents resistance. Moral hazard narratives excuse cruelty. Complexity obscures causality. Together, they create something unprecedented in human history. A system where preventable death is both profitable and acceptable. The machine works perfectly. That's the problem. But wait until you see the actual human cost. Because the numbers, they're just the beginning. The numbers tell one story, the names tell another. Start with insulin, the perfect case study in commodified survival. When Frederick Banting discovered insulin in 1921, he sold the patent for $1. $1. He said insulin belonged to the world. Today, the three companies that control 90% of the global insulin market have increased prices by over 1,200% since the 1990s. Not because insulin improved, the formula is essentially unchanged, because they could. Meet Josh Wilkerson, age 27. Aged off his stepfather's insurance, he couldn't afford insulin, $1,200 a month. He switched to cheaper Reliant insulin from Walmart, but it works differently. His blood sugar spiked. He fell into a coma. His fiancée found him dead on their couch. The GoFundMe for his funeral raised $11,000. He'd needed a fraction of that to stay alive. Let that sink in. We crowdfunded his funeral, but not his survival. The insulin crisis isn't unique. It's the system working as designed. Consider Martin Shkreli. Remember him? In 2015, his company acquired Daraprim, a 62-year-old drug treating parasitic infections in AIDS patients. Overnight, he raised the price from $13.50 to $750 per pill, a 5,000% increase. When asked why, he said he should have raised it higher. The real scandal? This was legal, normal. Shkreli just said the quiet part loud. Now, scale up to systemic level. A 2019 American Journal of Public Health study found that 530,000 American families file for bankruptcy annually due to medical bills. Think about that number. 500,000 families every year, financially destroyed by illness. That's more than the population of Atlanta. Every year, wiped out. But maybe that's too abstract. Let's make it personal. The Commonwealth Fund compared healthcare across 11 wealthy nations in 2021. The United States ranked last in access, equity, and outcomes. Last. We spend $12,530 per person annually on healthcare. The second highest spender, Germany, spends $6,518. We pay double for last place. What does last place look like in human terms? Maternal mortality. 17 deaths per 100,000 births in America versus 7 in Canada. Preventable mortality, 85 deaths per 100,000 in America versus 51 in Australia. These aren't just statistics. These are 40,000 additional Americans dying annually who would live if we had other countries' systems. 40,000 people every year dead because of where they were born. COVID revealed everything with brutal clarity. Remember the early days? Who got tests first? The wealthy. Who got monoclonal antibodies? Those with connections. Who died at higher rates? Essential workers, minorities, the poor. The virus was biological. The deaths were political. Kaiser Family Foundation tracked it. COVID hospitalization cost an average of $20,000 for uninsured Americans. Insured people paid an average of $1,400. Same disease, same hospitals, same treatment. Different bills based on your coverage lottery. Some families lost loved ones and received six-figure bills as a parting gift. But here's what should haunt you at night. Other countries didn't do this. In the UK, NHS treatment is free at point of use. Period. In Canada, single payer means no medical bankruptcies. In Germany, everyone has insurance, premiums are income-based, and nobody dies from rationing insulin. These aren't utopias. They're just societies that decided survival shouldn't require a credit check. The Peterson KFF analysis found that Americans pay 4 times more for the same drugs as other countries. Humira for arthritis, $6,710 per month in America, 1,225 Swiss francs in Switzerland. EpiPens for allergic reactions, $600 in America, 69 pounds in the UK. Same product, same company. Different price because different countries have different values. Have you ever wondered why every other developed nation looks at American healthcare with horror? It's not because they're naive about economics. It's because they remember something we've forgotten, that healthcare isn't just another market transaction, that there's something obscene about profiting from desperation, that a society that lets people die for money has lost something essential. The evidence is overwhelming, the study's conclusive, the international comparison's damning. We know exactly what we're doing. We have the receipts, 530,000 bankruptcies, 26,000 preventable deaths, families choosing between insulin and rent. These aren't failures of the system. This is the system. And now I need to ask you something uncomfortable. Are you part of it? Stop for a moment. This isn't about them. It's about you. Have you ever sat in your car outside an emergency room, Googling whether chest pain is emergency room serious or urgent care serious? Not because you're consulting medical websites for accuracy, but because you're calculating whether you can afford to be wrong. That's not healthcare. That's gambling with your life as the stakes. When did GoFundMe become America's health insurance? Scroll through it right now. Help Sarah fight cancer. Tommy needs heart surgery. Insulin for Maria. Each one a story of medical need meeting financial reality. We've crowdsourced survival. We've turned illness into a popularity contest where the most shareable stories get to live. Ask yourself, and be honest, do you know what your insurance actually covers? Really know? Or do you find out when they deny something? When the anesthesiologist at your in-network hospital turns out to be out of network? When the ambulance that saved your life sends a bill that might ruin it? Here's a test. Answer honestly. Have you ever done any of these things? Skipped doses of medication to make it last longer. Avoided calling an ambulance and took an Uber instead. Declined a test or procedure your doctor recommended. Stayed at a job you hate for the insurance. Googled how to get antibiotics without seeing a doctor. If you answered yes to any of these, you've already internalized it. The logic that your health is conditional, that your body's needs must submit to market calculations. You're not just witnessing the system, you're living it. Young adults know this dance intimately. 26, the age you're kicked off parental insurance, has become a countdown clock to potential death. They call it the birthday present from America. Happy birthday. Your inhaler now costs $400. Some get married for insurance. Others stay in abusive relationships. The body becomes a liability you can't afford. Watch how we've normalized the vocabulary of denial. Prior authorization, meaning someone who's never examined you can override your doctor. Formulary restrictions, meaning the medication that works for you isn't covered, but this cheaper one might be. Step therapy, meaning you must fail on cheaper drugs before accessing what your doctor prescribed first. We don't even hear the absurdity anymore. We've gone numb. Other countries find this incomprehensible. Imagine explaining to someone from France that you're staying at a job that's killing you because without it, your diabetes will literally kill you. They wouldn't understand. Not because they're naive, but because they're sane. The question isn't whether you've been affected, you have. The question is whether you've noticed, and whether you're ready to hear what America does get right, because that's where things get complicated. Let's be honest about what America gets right. When Steve Jobs needed a liver transplant, he didn't fly to Canada. When wealthy Europeans need cutting-edge cancer treatment, they come to MD Anderson in Houston, the Mayo Clinic, Cleveland Clinic, Johns Hopkins. These aren't just hospitals, they're medical miracles factories. If you have a rare disease and unlimited funds, America might save your life when nowhere else can. The numbers support this. Of the last 40 Nobel Prizes in medicine, Americans won 23. We developed more new drugs than the rest of the world combined. The COVID vaccines that saved millions, Moderna and Pfizer. American innovation. When the world needed medical breakthroughs at warp speed, the market delivered. Here's what defenders argue, and they're not entirely wrong. Price controls stifle innovation. If we cap insulin prices, who develops the next generation of diabetes treatments? If we regulate pharmaceutical profits, what happens to research funding? The cruel paradox. Today's astronomical prices might fund tomorrow's cures. Universal systems have their own shadows. Talk to Canadians about 8-month waits for knee replacements. Ask the British about NHS nursing shortages. In France, doctors strike against bureaucratic overload. No system is perfect. Every system rations, some by price, others by time. The Steelman argument goes like this. American healthcare is expensive because American healthcare is ambitious. We don't just treat disease, we war against death itself. We'll spend $500,000 keeping a 90-year-old alive for 3 more months. Other countries wouldn't. Is that waste or compassion? Who decides? There's something else we rarely discuss. Many Americans with good insurance love their health care. They get same-day appointments, top specialists, immediate surgeries. For them, the system works beautifully. When politicians say people like their insurance, they're not lying. The covered live in a different country than the uncovered. But here's where the counter-argument collapses into moral rubble. Excellence for some doesn't justify abandonment of others. Yes, we innovate, but insulin was discovered in Canada. Yes, we have short wait times for those who can pay. Yes, we develop new drugs, often with taxpayer-funded research that gets privatized for profit. The COVID vaccines, built on decades of public investment. Other countries achieve innovation without cruelty. Switzerland has pharmaceutical giants and universal coverage. Sweden has medical innovation and no medical bankruptcies. The trade-off, innovation or access, is false. We tell ourselves this story to make the unnecessary suffering seem necessary. The complexity is real. The solutions aren't simple, but complexity doesn't excuse complicity. When we know people are dying for lack of insulin while we debate market incentives, we're having the wrong conversation. The question isn't whether markets can deliver healthcare innovation. They can. The question is whether innovation that only benefits those who can afford it is worth celebrating while others die from the basics. So what do? Because doing nothing is a choice, and it's killing people. You can't fix a broken system alone, but you're not powerless either. Start with what you control. Healthcare literacy isn't just understanding your coverage, it's survival intelligence. Read your insurance documents. Actually read them. Learn the appeals process. Most coverage denials get overturned when challenged, but most people don't challenge. They assume the first no is final. It's not. Preventive care is resistance. Every dollar spent on prevention saves $8 in treatment, but prevention requires privilege, time, money, access. If you have those privileges, use them, not just for yourself, for the system you want to see. Mutual aid networks are resurging for a reason. Churches pooling resources for members' medical bills. community fridges including insulin, neighbors teaching neighbors how to navigate Medicaid applications. This isn't charity, it's solidarity. It's remembering what we knew before the market convinced us otherwise, that we survive together or not at all. But let's not pretend. Individual solutions are band-aids on cancer. We need structural chemotherapy. Universal health care isn't radical. It's what every other developed nation considers normal. Medicare for all, single-payer, public option. The labels matter less than the principle. Healthcare is human right, not consumer good. The Congressional Budget Office found Medicare for all would save $650 billion annually. We'd spend less covering everyone than we spend abandoning millions. Drug price regulation works. It's why insulin costs $30 in Canada, not $300. The Inflation Reduction Act's provision allowing Medicare to negotiate drug prices, fought tooth and nail by pharma, will save billions. It's proof that change is possible when political will exists. But here's the harder truth no one wants to say. We need to change incentives, not just prices. Fee-for-service rewards procedures, not outcomes. Hospitals profit from sick people, not healthy ones. What if we paid healthcare systems to keep communities healthy? What if doctor bonuses depended on patient wellness, not billable procedures? Other countries have proven paths. Germany's Bismarck model, universal multi-payer system with private insurers regulated like utilities. UK's Beveridge model, single-payer funded through taxes. Japan's hybrid, mandatory insurance with aggressive price controls. Each different, all universal. The transition wouldn't be painless. Insurance companies employ 2.7 million Americans. Those jobs would vanish or transform. Hospitals running on thin margins might close. Doctors trained in the current system would resist. Change is disruptive, but so is letting 26,000 people die annually. Here's what history teaches. Power never yields voluntarily. The NHS wasn't gifted to Britain. It was demanded after World War II by people who had sacrificed everything and refused to return to the old ways. Canada's universal health care came, province by province, fought for by citizens who wouldn't accept neighbors dying from poverty. The path forward isn't mysterious. It's mapped. Other nations have walked it. The obstacles aren't technical or economic. They're political. They're the aggregate of our collective willingness to tolerate the intolerable. Every great moral advance in history began with people saying, "This is wrong, and we're going to change it." Your move. But before you decide, you need to understand what this system has done to our souls. Something happens to a society that lets markets decide who lives. We become different people, not overnight, not obviously, but slowly, inevitably, we internalize a logic that corrodes the human spirit. When healthcare is commodity, suffering becomes price signal. When medicine is market, compassion becomes liability. Think about what we've trained ourselves to accept. A GoFundMe for chemotherapy doesn't shock us anymore. We scroll past. Maybe donate $5, maybe share. But we don't ask the question that should haunt us. Why is this person crowdfunding their survival in the richest society ever built? We've developed what psychologists call learned helplessness. We've been shocked so many times by medical bills, denied coverage, impossible choices, that we've stopped believing anything else is possible. We mistake our cage for the world, but it goes deeper, so much deeper. We've internalized the market's verdict as moral judgment. Can't afford insulin? Should have worked harder. Medical bankruptcy, poor planning, rationing medication, personal responsibility. We've weaponized the Protestant work ethic into a death sentence. We tell ourselves stories about bad choices and lifestyle diseases to avoid confronting the truth. In our system, poverty is comorbidity. Being poor is a pre-existing condition. Watch how this thinking infects everything. We start evaluating humans like investments. Is grandma's hip replacement worth it at her age? Should society pay for that premature baby's NICU stay? What's the return on investment for treating addiction? We're doing cost-benefit analysis on human beings. We're spreadsheet souls. Do you see what we've become? We're actuaries of existence, accountants of agony. Other societies find this incomprehensible, not because they're more generous, but because they haven't forgotten something fundamental. We are interconnected. Your illness affects me. My health affects yours. We're not individual consumer units making rational market choices. We're vulnerable beings who need each other to survive. The commodification of healthcare hasn't just denied treatment, it's changed our capacity for solidarity. When you believe health is earned, not deserved, you stop seeing suffering as injustice. You see it as consequence. The system hasn't just privatized medicine, it's privatized empathy. Here's what we've lost. The understanding that caring for the sick isn't charity or burden. It's what makes us human. Every society in history has known this. We're the first to forget. We've created actuarial tables where there should be moral commitments. We've put spreadsheets where souls should be. The real cost isn't measured in dollars or deaths. It's measured in what we've become. A people who've normalized the unthinkable, who've made peace with preventable suffering, who've convinced ourselves that some lives are luxury goods. That's the price we're really paying. And now we face a choice. We stand at the mirror moment, not the comfortable distance of policy debate, not the safety of statistics, but the raw, uncomfortable place where we must ask, what does it say about us? Not our system, not our politicians, not our corporations, but us. That we've built a society where insulin sits locked behind pharmacy counters while diabetics die outside. Every society faces a choice about what kind of people they want to be. We've made ours. We've chosen to be the people who ask, how much? Before, how can we help? We've chosen to be the society that turns emergency rooms into credit checks, that transforms cancer into bankruptcy, that makes survival a luxury good. But choices can be unmade. Tomorrow, someone you know will skip their medication. Someone in your community will decline an ambulance. Someone's child will ration insulin. This isn't happening in abstraction. It's happening while you read this, while you breathe freely, while your heart beats without a price tag. Look at yourself. Right now, you're reading this, which means you're alive. You've survived every health crisis so far. But what about tomorrow? What about when it's you in that emergency room, calculating whether you can afford to live? What about when it's your child rationing insulin? The question isn't whether you'll act, you will. Through action or inaction, you're choosing. The question is whether you'll continue choosing the comfortable fiction that this is inevitable, or whether you'll join the ranks of those throughout history who've said, this ends with us. History is watching. Future generations will study this moment, when the wealthiest civilization ever built let its people die for profit. And they'll ask what we're all thinking but not saying, how did they live with themselves? Here's the final paradox. The system seems impossibly entrenched, but it's actually fragile. It depends entirely on our participation, our silence, our assumption that this is just how things are. What happens when we stop assuming? What happens when we stop accepting that some lives are worth more than others? What happens when we remember what every other civilization has known? That caring for the sick is sacred. The system survives on our resignation. It feeds on our exhaustion. It counts on our belief that nothing can change. But everything can change. Everything. History proves it. Every system that seemed eternal has fallen. Every injustice that seemed permanent has ended. But only when people stopped accepting the unacceptable. What does it say about a society when survival is a business model? More importantly, what does it say about us if we let it continue? Your answer matters. Lives depend on it, including one day your own.